There's a very elaborate follow-up care plan for patients who have received lung transplants. That includes a very elaborate appointment schedule and testing schedule, but also medications.
Following the transplantation, patients have to be seeing us on a weekly basis. That's weekly, sometimes twice in a week if there's something that we're concerned about. So weekly for 1 month, then every other week for another month, then monthly, and then we go every 3 months for the rest of life.
Patients also have at least 5 bronchoscopies scheduled in the first year after their transplant. With that procedure, we place a scope down through the windpipe into the lungs to examine the interior of the transplanted lung, as well as to take cultures to make sure no infections are developing, and to take some tiny biopsies to rule out the possibility of rejection that can happen even with a patient taking all their medications, their rejection medications.
Following transplantation, the medications are our biggest concern. The immunosuppression medications made transplantation possible back in the 80s and 90s. That's what made transplantation successful. However, these medications have a lot of side effects. They can cause complications such as decreasing the density of the bone, which can lead to osteoporosis. So we have to provide medications to prevent those complications. It can cause hypercholesterolemia, high cholesterol, hypertension, high blood pressure.
We frequently have to use medications in addition to the transplant and antibiotic medications to treat each of those side effects. So through this description, you can understand that a patient can be on about 30 pills a day with a lot of organization involved, because some of them are once-a-day medicines, some are twice-a-day medicines, some are 3 times a day medicines, some are 3 times a week medicines.
It's overwhelming, so a patient cannot do it alone. It's very important that they're compliant and have a family member or family members that are very involved in their care to help them through this process.
The patients are self-monitoring at home for signs of infection or rejection with a daily blood pressure, daily temperature, a daily spirometry test, which is a breathing test, all recorded on logbooks that are meant to prompt phone calls to us when something doesn't look right.
Compliance is utmost importance in being transplanted for lung transplantation. When we tell patients to take a medication every 12 hours, which their immunosuppressions have to be taken because it goes into their system and then it plateaus into their bloodstream and then starts to drop off. If we tell them to take that medication every 12 hours, it's important that they take it every 12 hours because that's going to affect their outcome.
You can easily see that a patient after a lung transplant requires a lot of attention, both by the medical doctors and nurses and by the patients themselves and their families. And it's only with a very good communication, which we encourage, and by good cooperation that we can together take care of the lung transplant recipient for the long term. And by long term, I mean we're hoping for 20 and 25 years.
Lung transplantation basically has been my life for the last 20 years. I've enjoyed working with this population. It's wonderful to have patients come to us, see them sick the first day that they walk in. We see them and then 17 years later, 20 years later, to have them walk in and to say thank you for helping me, to have me see my children raised, to be able to see my children get married, to see my grandchildren. This is what we do it for, is to keep patients alive, to have them here. And compliance is so important. We want you around a long time.